Hello, everyone, and welcome to Navigating the Roadmap to Trustability, a Peppers & Rogers Group webinar. I'm Liz Glogowski, Executive Editor of Strategy and moderator for today's event. Before we get started, you'll notice that we have a Twitter hashtag for today's event, PRG Healthcare. So during the program, I'll be live tweeting, so feel free to connect and share what you learn from the event via Twitter during the event and to follow up with PRG Healthcare afterward. And I'll be at Peppers Rogers is our Twitter feed. So welcome. Let's get started. Today's speakers are Mark Ruggiano, a partner at Peppers & Rogers Group, and Dietrich Chen, PhD, a director at Peppers & Rogers Group. Mark leads Peppers & Rogers' healthcare practice and brings a wealth of experience and cross-industry expertise to today's discussion. He will review the findings from Peppers & Rogers Group's trust research and will define Peppers & Rogers Group's Trustability platform. Dietrich has served on a wide variety of consulting engagements and helped develop our trust framework. He will share the business case for trust, detailing some recent client work on trust-building activities. So before we get to the agenda, there are a few On24 interface logistics to go over. First, for a PDF copy of today's slides, you can click the green PDF icon at the bottom left of your screen. If you encounter any issues with the PDF, please notify us via the purple Contact Peppers & Rogers Group button. We also encourage you to ask questions of our presenters during the event. You can click on the red Q&A button on your screen, type your question, and hit Submit. We made time at the end for a Q&A session, so you can submit your questions throughout the event, which we will go over at the end. And your questions will be discussed anonymously during the presentation. We also want to make this an interactive experience, so we have 2 poll questions we'll ask during the program. And we also have a brief survey at the end of the program that we'd ask that you participate in. And for that one, we recommend that you turn off your pop-up blockers for that. Also, there's a self-help feature with the enlarged slide link, and you can also find a list of FAQs in yellow. And of course, submitting a question is always an option if you run into trouble. Our technical team is on hand to answer any questions you may have. Additionally, contact information for both Mark and Dietrich will be posted at the end of our event. All right, so let's move on to our agenda. Mark will begin with a recap of the trust research that we presented in our last webinar called Measuring the Value of Trust for Health Insurers. Then he will detail the 6 building blocks of trust that create a company's trust platform. Then Dietrich will share some real-world examples from clients about how to operationalize trust into business activities. Then Mark and Dietrich will take your questions in a Q&A session. So let's begin. Mark, I'll turn it over to you to continue the presentation.
Great. Thanks, Liz, and thanks to everybody for joining us today. I look forward to hearing your thoughts and questions and talking interactively towards the end of the hour. The first topic is to recap the trust research. As we at Peppers & Rogers started to go down this path, the path that has led us to where we are today, talking about trust and the role that it plays in healthcare and for health insurers in particular, we started by asking some questions of the consumers that make up the market. We explored with them their perceptions of today's health insurers, and you can see a tag cloud or a word cloud on the screen right now that summarizes it. You can see that consumer perceptions today are predominantly negative, and that's not hopefully a surprise to anyone that's participating today. You can see words like frustrating and confusing. You can see impersonal and uncaring, distant and self-centered. But it's not all negative. There are positives too. You can see a concentration of them in the lower left-hand corner where you'll find intelligent and consistent, and another cluster in the upper right-hand corner where you'll see well-intentioned, strong, and friendly. We continue this exploration by asking consumers what their ideal health insurer would be like, and what you see in front of you here is the tag cloud of some of those responses. You can see on here things like knowledgeable, caring, sympathetic, and understanding. You can see another theme around honest, transparent, accessible, and personal. And the word that I haven't yet mentioned, which our research has shown to be the most fundamental, and as the title of this presentation and discussion would indicate, is trustworthy. You can see that this is bubbled to the surface, we saw, because of the links between trustworthiness, or what we call trustability, the links between trustability and the strength of the relationship that health insurers can form with their members and consumers in general, because of the strength of the links between trustability and the health outcomes, which are a primary motivation for many of us being in the business that we're in the first place. And finally, strong links between trustability and consumers' willingness to pay. So whether you're in a for-profit or a not-for-profit situation, financial considerations and financial management is a more important focus today than it has ever been. And that is another reason why trustworthiness or trustability is or should be at the top of most executives' agendas. We're going to explore a couple of things very quickly. What you see now are the first of two slides that capture some of the high-level findings from our research. You can see here on this slide a segmented circle that has distrusters, consumers who were neutral, and trusters. Trusters are in green. And the primary takeaway is that nearly 2/3 of consumers are either undecided or distrustful of the industry. And that headline is what led us down this path to explore what companies can do to influence and change this situation and how they can benefit from it as a result. First, we explored the degree of variation that was found in the answers. And the slide that you're looking at now shows some of the larger health insurers who were mentioned by consumers in our research. The columns are ordered from left to right based on the percentage of trusters, from low on the left to high on the right. You can see that the percentage of trusters varies from a low of about 26% in this set of health insurers to a high of about 55% all the way on the right for Kaiser. Across all but Kaiser, the percentage of distrusters hovers in the low to mid-40s. And as you can see, Kaiser has a significantly lower percentage of distrusters. Next, we're going to look at a couple of the ways that companies can impact trust, some of the specific things that drive trust or distrust among your member base. This slide talks about the basics. Doing the basics well is an important component and an important driver of trust. The basics are things like having an easy enrollment process, processing claims efficiently and correctly, being able to work with your members' doctor's offices and other healthcare professionals as necessary to best serve them, being innovative and bringing new products or new tools and technologies that enhance the healthcare experience and the outcomes that your members receive, and finally following through on the things that you promise and that your customers expect. All of these are the basics, and doing the basics well, as you can see by the gap between the blue distruster bars and the green truster bars, doing the basics well is a big driver that we have explored even further. The next topic on the following slide is communications. These are communications from the health insurers to your consumers or your members. And you can see here that communications from you to your customers are extremely critical. Some of the keys for trustable communications are that communications are clear, that they're timely, that they're proactive. Obviously, there is a very heavy emphasis among respondents to our research to seeing these attributes in EOBs and other official communications. And then finally, that communications from health insurers are personalized, which is a theme that we see surfacing in many different parts of the research. Consumers expect, based on all of the information that they know or believe that their health insurer has on them, they expect communications and many other things to be personalized. The next slide takes a look at a couple of specific attributes of communication related to frequency and channel. And you can see here that both the amount and the channel, specifically the preferred channel, are important drivers. As you can see, getting it right is most important, obviously, but there are extremes that are have a more negative impact than others on the level of distrust. What you see next are communications with the health insurer, and in particular, these questions in our research focused on customer service, and within that focused on live representatives in the interactions that they deliver. And you can see once again that this is a big driver of trust and distrust. Important factors are listening and understanding what customers are saying and what they need, solving problems or being able to access someone within the company that can solve problems. Some other seemingly simple things like sincere thank yous or I'm sorries in appropriate circumstances. And finally, asking for feedback and making clear that your organization values it and acts on it. Lastly, the next couple of slides will demonstrate the results of our research as they relate to the impact of trust. And what you'll see here is that trust has a tremendous impact and is a tremendous opportunity for many healthcare companies. This slide looks at loyalty. Trusters are more loyal, and they evidence that, as you can see by some of the sample items at the bottom of the slide, by not actively looking for alternatives. They believe that they will be customers of the health insurers that they trust for a long time to come, and they feel a strong sense of loyalty. The next topic is the impact of trust on advocacy, and Peppers & Rogers Group defines advocacy as a willingness to recommend a company and a propensity to take action on that willingness. And so those two components to us make up advocacy. And as you can see here, trusters are much more likely to be active promoters or advocates of the health insurer that they trust. The third area is health outcomes. You can see here that trust positively impacts health outcomes by increasing the likelihood that trusters will follow their doctor's instructions, that they'll follow the instructions of health insurers, and overall that they lead your members to believe that they're healthier because of their relationship with you. And the third and final outcome, trustable companies can command a premium over less trustworthy competitors. You can see that the distribution here, and these bars or columns are in dollars per member per month, or per subscriber per month, I should say. And you can see there's a fairly wide range. On average, though, consumers who trust their health insurer are willing to pay approximately $30 per month more for the service and the experience that delivers that trustable feeling. So for many companies in the industry, this is a multi-$100 million, if not billion-dollar opportunity on an annual basis. And that's why we are all here today, to talk about how a company can build a platform to be trustable and to capitalize on these opportunities. And that's what we'll get into next. Before we move into the second section of our discussion today, I just want to remind you that the research that Liz referred to, which we presented in a previous webinar, that's still available online, either to download as a report or to listen to in the form of a recorded webinar. So if you're interested in more details on the research, please let us know, or please visit our website where you can access the content that I just mentioned. Now we're going to talk about how companies can capitalize on the trust opportunity and create a platform on which to build a trustable company. The initial topic, though, is to frame trust and to break it down into the key components that we're going to talk about. Trust is made up of goodwill and competence. Goodwill means acting with your customer's best interest at heart, or we simplify it so that it can be more easily communicated within our clients' organizations to doing the right thing. And competence means reliably delivering on promises and expectations. And again, simplified means doing the right thing. Or doing things right, I'm sorry. Competence means doing things right, and goodwill means doing the right thing. What is critical to remember, though, is that both of these have to be done proactively. Right? So proactive goodwill and proactive competence are the two pillars on which the trust platform are built. And next we're going to explore the 6 building blocks that companies can focus on. What we're going to do for each of these is I'm going to introduce them, all 6 of them, so you have a sense of what the building blocks are. Then we'll talk through some of the key questions that you can ask yourself and you can ask your colleagues within your organization that will help you identify places where enhancing your trust platform can be beneficial and where your efforts and your investments can best be focused. And then at the end, we'll recap the 6, and then my colleague Dietrich Chen will talk about some client work that highlights how organizations can build this platform. So the first 3 building blocks support the goodwill pillar. They are empathy, transparency, and accountability. Empathy means anticipating customer needs, understanding the context in which customers present those needs, and then working with customers to identify and deliver beneficial solutions. So the keys there around customer needs, around context, and around beneficial solutions are what we'll focus on when we talk about the empathy building block. The second one here is transparency. The key parts of transparency are proactive and reactive open communication, and that'll be the focus of what we explore in transparency in just a few minutes. Accountability is the third and final one supporting the goodwill pillar, and that means taking ownership and action both at an individual and an organizational level to address negative or potentially negative customer experiences. The competence pillar is supported by the 3 building blocks: customer experience, empowerment, and recognition. Customer experience is delivering accessible, convenient, consistent, and credible experiences to customers regardless of all else. And the regardless part is an important component to understand, right? Whether or not the information, the decision, or the course of action is exactly what the customer wanted, the delivery of that information, the experience the customer has during that interaction should follow these 4 attributes of accessibility, convenience, consistency, and credibility. The 5th building block is empowerment, which means training, enabling, and authorizing your employees to take actions that earn customer trust. And then the 6th and final is recognition, right? Or more specifically, recognizing and rewarding trust-building actions and customer-centric behaviors of high-performing employees. And I think it's important, and we'll come back to it, to recognize that performance, or more specifically high performance, and trust typically are correlated. And we'll talk about why and how when we talk about the recognition building block. Now, let's take a closer look at each of the 6 building blocks and some of the key questions that will allow you to determine how strong your trust platform is today. The first building block is empathy. Remember that empathy means that you anticipate customers' needs, that you understand the context in which they present, and that you work to deliver beneficial solutions. Some of the key questions that make up this building block are listed below. The first one is, do you understand your customers' health-related goals and objectives, and do you know what motivates their health-related decisions? And it's important to note that this is not an in general question. It doesn't mean that you have a market research report that in general explains what your customers are looking for or what their motivations are. What this means is that you know these things for each customer, and that is a difficult task, but one that leading companies are able to solve and are doing today. The second key question is, have you clearly defined the role that you intend to play and set customers' expectations appropriately? This one is important because being empathetic is only beneficial and trust building if it's also genuine. And without having a clearly defined role that you and your organization expect to play in helping the customer achieve their health-related goals and objectives, you cannot be both empathetic and genuine. And so this second one is an important component of the empathy building block. The third one talks about the accessibility of the insights. So are your customer-facing employees armed with knowledge about what customers need and the context in which those needs exist? The fourth key question is focused on beneficial solutions and understanding at the customer-facing employee level what products and services that your organizations offer are best for what types of customers. So that using that information and the interactions with customers, that your representatives can identify beneficial solutions and engage your customers in that dialogue. The final one in the empathy section is that do you match customer service staff with customers based on the attributes that you see listed on screen? And this is an important one because the best channel and the best forum in which to demonstrate empathy is obviously live interactions. You know, there are certainly guidelines and best practices related to manufacturing or creating empathy, creating feelings of empathy, you know, through other non-personal interactions. But the best place for most organizations to work on and develop and deliver empathy is in live interactions. And an important part of doing it well there is getting customer service staff engaged with customers in a smart way based on what you see on screen here. So that's the empathy building block. The second building block is transparency. And some of the key questions in transparency are, do you have an efficient method of communicating with each of your customers? For many organizations, this is as simple as saying, have we collected email addresses? Or do we have telephone numbers? And do we have those and understand our customers' preferences between those two main methods of communication? For other clients that we work with, they have that aspect of it down pat, and they are working on new media, new channels, social media, more interactive, empathetic, and transparent online experiences, etc. But the most basic question is, you know, do you have that two-way communication? Can you do it efficiently? And can you do it with each and every one of your customers? So that's the first key question within the transparency building block. The second is related to being able to be transparent and explain a decision, explain an outcome, explain a situation, etc. And many clients' first reaction is to limit the accessibility of that explanatory information, thinking that they don't want customer service reps to get into a discussion that may be over their heads, that may lead to longer call times and other things that are commonly thought of as negative. In reality, enabling your customer-facing employees and in many cases your self-service channels to deliver that explanatory information is a key enabler of the transparency building block. The next one is around language, both the language that's used, the word choice and other things, and the level that things are written and communicated at. The fourth one is about proactivity. As we said at the top of this section, acting proactively is an important component of all of these 6 trust-building building blocks. And then the final one here is related to the existence of and the accessibility of some sort of appeals channel, so that a customer who doesn't believe they're getting transparency through the area of the company in which they're currently engaged has another option. And this doesn't mean a formal or a regulatory-driven appeals process. It just means another option for communication. So that's the transparency building block. The third and the final one that supports the goodwill pillar is accountability. Accountability, again, means taking ownership and action at both the individual and organizational level. And some of the key questions are listed here. The first is, do we know, we meaning the organization, the company, and the employees, what we've promised to our customers? And I'll give you a quick example here that I think many of you will be able to identify with. I recently did some business with a telephone and online retailer of contact lenses. And I called. I'd used this company a couple of times, and I called because I had received a letter offering me an incentive to place an order before my prescription expired in a couple of weeks. And so I called the 800 number, and the first thing I was greeted with was a wonderful offer from the agent if I placed an order, at that particular moment, and she proceeded to take me through the ordering process without even asking anything about, or without mentioning anything about this letter that I had received. And so she was unaware of the promises in this letter and ended up offering me something that went over and above, went beyond, and probably cost the company significantly more than the offer which I had already responded to. And so a simple example of this agent didn't know the letter that the marketing department had sent out, didn't know what I had been offered or promised, and wasn't able to access that information at the time that we were interacting. And so this question is summarized in the first rectangle under accountability. There are other key questions. The second one is around accepting responsibility. I think a key word in this question is the second one, we. Right? It's difficult, if not impossible, to accept responsibility unless there's a particular individual that is doing it. And so when you say, as a company, we accept responsibility when we communicate wrong information, that's not a trust-building activity. It's only when the acceptance of responsibility is personal that it can be captured and that the actions can be institutionalized and that the customer can feel that accountability is taking place. The next one down is, do we track broken promises? And this is, I think, a very interesting one. Many companies in other industries, have metrics like in manufacturing, they track defects, and in many other industries, finance, for example, they track mistakes or errors, losses, etc. And so in our research, accountability is the critical building block, and one of the things that reflect on whether accountability is taking place or not is, does an organization track when it's broken promises that it's made? The next one down is, does the company and its employees have a process for resolving issues of ownership and action? This is similar to a quality process in a manufacturing environment, right? If accountability means taking ownership and action, then there needs to be a process that monitors how well an organization is doing that and how well individuals are adhering to it. And then finally, the last component of the accountability building block is, does the company or an employee act on 100% of the negative customer experiences that take place? And we believe that 100% is the only appropriate target, and that measuring the company's and the employees' actions and holding them up against the bar of 100% is an important part of the accountability building block. So we'll take just a deep breath here and move into the competence pillar. In the competence pillar, there are also 3 building blocks supporting it. The first of those is the customer experience. In this one, I'm going to go through relatively quickly. We covered it in the last webinar as an example of the Trust platform, and it is oftentimes an easier one for people to get their heads around and for organizations to understand. The customer experience, once again, is delivering accessible, convenient, consistent, and credible experiences to customers regardless of all else. When this is a well-developed building block, then organizations can answer yes to the questions that you see there. The questions are around the existence and high functioning of desired channels, the ability of customers to complete intended actions through those channels, being served by agents that are trained, that are relevant, that are empowered, and that understand the situation. Some consistency across all of these experiences is another important part. So receiving the same messages and having the same functions or capabilities offered across channels is critical. The next to last one is a very interesting one. It's, do you deliver on commitments? And we saw very clearly in the research that this is an important part. And some of the ways that this takes place, and you can check this in your organization, are do you offer trackable confirmation numbers for each interaction that a customer has with you? Is any agent able to schedule a follow-up, not just make a verbal commitment to follow up? Those are examples of delivering on commitments in a way that enhances the experience and supports the competence pillar. And then finally, are you measuring the experience that you deliver and its impact in particular on trustability? So that's the first building block in the competence section. The second one is empowerment. Empowerment means training, enabling, and authorizing employees to take actions that earn customers' trust. And you can see the key questions that you should ask that highlight capabilities that need to be in place for this building block to be well developed. The first one is the presence of well-defined trust principles and training all employees on those principles. Trust is something that many people innately believe they understand, but codifying how trust manifests itself in your company and turning that into a set of principles that everyone can see, that everyone's aware of, and that everyone is measured against is what we're talking about here. The second one involves employees in customer-facing roles having tools to understand and act when they are addressed with a customer issue. The next two relate to the existence of policies and permissions and controls. Trust and trust-related processes within an organization need to be managed and monitored the way any other important process is managed and monitored. And so establishing policies that guide trust-related activities, creating permissions for individual roles that are appropriate, and then putting controls in place to make sure that things are working the way they're supposed to. Those are two critical questions and critical capabilities that underpin the empowerment building block. And the last one in empowerment is the existence of a culture of trust. There are many ways of categorizing the culture of an organization, but any of those ways should be able to include the components of trust. And so making that a part of your culture, understanding how big a part it is today, and building that over time the way you build any other attribute of your culture is what we're talking about here. Together, those are the drivers and the key questions that relate to empowerment. The final building block is recognition. And what we mean by recognition is both recognizing and rewarding trust-building actions and customer-centric behaviors and linking that to high performance. So you can see the key questions that should be asked and that highlight the capabilities that need to be in place for this building block to be well developed. Are actions that build trust and enhance customer centricity tracked at the employee level? That means more. That means more than just noting that your call center UI, for example, tracks each interaction. What it means is identifying those actions that build or detract from trustability, and tracking those and being able to report on those in appropriate instances as well. The second one is around the integration of trust-related components into recognition programs. And the third one is about the same thing, integration into performance management programs. So, as we've said, trust-building activities, should be just as easy to recognize for managers and for the employees that they manage as many other types of behaviors are. And a well-developed recognition program will have a specific component to recognize and encourage trust-building activities. And the same thing for performance management. So employees should be rewarded for demonstrating these types of activities, and specifically metrics and KPIs should be developed that can allow a quantitative assessment of an employee's trust-building activities. And then lastly, in the recognition building block is the question, are trust leaders among your employee base viewed as highly valuable assets? Many HR professionals have a list of the characteristics of the most valuable employees or types of employees in a company. And on that list, high on that list, should be trust. Trust, as we've talked about, is a valuable concept, and increasing trust among your customer base, a valuable goal. And employees that are good at it are highly valuable assets, and that is a critical component of the recognition building block. So in summary, building a trust platform that allows you to realize some of the benefits of trustability that we talked about, such as increased loyalty, increased advocacy, improved health outcomes, and positive financial impact. Building that platform means developing the ability as a company to answer each of these questions that we've talked about in the affirmative. You can see the 6 building blocks summarized here: empathy, transparency, and accountability, all of which support goodwill or doing the right thing; customer experience, empowerment, and recognition, all of which support the competence pillar or doing things right. And remember that these 6 building blocks enable you to have a trust platform on which to become a more trustable company. And proactively applying them is another important key. Before I turn things over to my colleague Dietrich Chen, Liz would like to ask you a question about the 6 building blocks and which of them seems like it is most important to your organization. Liz?
Oh, thank you, Mark. Yes, so here's a time we're going to ask you guys, based on these very important 6 building blocks, from your company perspective, we are curious to know which of the 6 building blocks provides the most immediate opportunity to build trust within your organization. So judging by what Mark just presented, are there any that stand out as a place to get started, or somewhere that may have the quickest impact to build trust? So is it within the goodwill pillar, empathy, transparency, accountability, or within the competence pillar, customer experience, empowerment, or recognition? So if you can take a moment to think about it and provide your answer, we'll give another moment, and then we will check out the results. Okay, that's probably enough time. So here we go. So the answer is based on your answers. If there we go, is looks like customer experience seems to have the most immediate opportunity for impact, followed by empowerment and recognition, then empathy and accountability and transparency as the probably the least immediate impact. So that's very interesting and feeds right into some of the examples that Dietrich will present now. So if Dietrich, you'd like to start your section based on some client work and some actual examples of building trust within an organization.
Thanks, Liz. To make matters a bit more concrete, I'll walk you through an actual client example. Mark talked about in the earlier section why trust matters, and how we look at trust, decomposing it into several components. But I think it's going to be interesting to see that we can actually operationalize the trust framework that we developed. We'll talk about the different phases of the project. In our project approach, as you can see, our project approach consists of 3 phases: a trust assessment phase, then developing the trust platform based on the trust framework that Mark described, and then putting the trust building initiatives on a roadmap. In the assessment phase, we make sure that senior leadership is aligned in terms of the importance of trust. We need to make sure it fits into the overall corporate strategy. We conduct member surveys to baseline and benchmark against the industry. And also, in this case, we conduct that online service for the employees to gain additional trust insights. I think it was interesting to see how enthusiastic the employees were about the survey. So we were able to get a almost overwhelming response in terms of trust-related issues and challenges and opportunities that the employees have seen through their interactions with the customers. So that proved to be a very fertile ground when we looked at trust-building initiatives. And then together with the clients, we developed trust guiding principles to guide the action of employees and the way the organization should communicate with their customers. The second phase, we conducted a gap analysis and identified trust-building initiatives based on the trust framework and its 6 components that Mark described in the previous section. Those initiatives then were prioritized along several dimensions. Obviously, the dimensions of trust impact, whether it moves the needle in increasing the trust with their customers. Our client was particularly interested in gaining momentum quickly with their trust initiative. So ease of implementation or feasibility was an important dimension that we looked at. And then lastly, the financial impact. So the last phase then is putting all of those initiatives that we identified on a roadmap by sequencing them based on the objectives and capacity constraints of our client, and then detailing them out, basically providing mini project plans for each of the roadmap items. So I just want to talk a little bit about some of the key activities and the deliverables for each of the phases. In phase 1, we developed trust guiding principles with our clients, and you can see on the left-hand side the familiar trust framework with its 6 building blocks. And on the right-hand side, you see some of the trust guiding principles that we developed. The 3 that we show here are an example of some of them. It's not a holistic list, but you can see how, for example, the first one, we transparently communicate what is best for our customers, ties back to the goodwill portion of the trust framework. In particular, it ties back to both transparency as well as empathy. And, we transparently communicate, ties back to the transparency building block, and then communicating what is best for our customers is putting ourselves into the customer's shoes and showing empathy. And similarly, we provide our customers with the expected customer experience for all products and services ties back to the customer experience building block. And the last one that we show here is it should actually tie back into the empowerment as well as recognition building block. As we mentioned before, the voice of employee questions were developed based on the trust framework, and you can see the familiar framework on the left again. As noted, the employees were quite enthusiastic, and we had many responses to our questions that we distributed via an online survey. So again, the questions are written so that they target the specific building blocks of the trust framework so that we can tie back the gaps that we identified to the individual building blocks. The first one, do you think our company is transparent in the way we communicate with our customers? Ties back to the transparency building block and the goodwill portion. The second question relates to accountability. The third one to customer experience, and the fourth one to empowerment, and so on and so forth. So again, these are just 4 examples of some of the voice of employee questions that we designed and distributed. There were many more that would target different aspects of the trust framework. Then in phase 2, based on the gaps of the trust building blocks that we discovered through interviews, through the online service that we conducted, we developed what types of gaps existed within the organization, and then developed the initiatives to close the trust gap. So there was a lack of awareness that was coming through on a variety of topics. Lack of awareness about comparative products and pricing advantages. Lack of awareness that our client actually was creating innovation-leading products and services. And our client was also recognized in the industry for providing customer service at a very high level. So they won numerous awards for their customer service leading experiences, and a lot of the consumers were not aware of those. So you can see how these trust gaps that we discovered would lead to initiatives in order to close those trust gaps. So as an example, building awareness and educating the members about the various offerings that the company had, as well as educating them about the relative performance of the company vis-a-vis its competitors, was put on a separate initiative. Again, these are examples of how the trust gap that we discovered would lead into initiatives in order to close the gaps. There were, as you will see later in our roadmap, more than 40 initiatives being discovered. Once we had our list of initiatives, we needed to prioritize them. As I said before, our client was in particular interested in moving very quickly. So feasibility or ease of implementation was a very, very important component of how we would prioritize. You can see, the 3 dimensions here: trust, impact, and feasibility. If we wanted to look at opportunities that would impact all of the 3 dimensions in a positive way, then you would end up in the quadrant on the upper right-hand corner. Within this quadrant, we would then phase out different opportunities based on the ease of implementation. And then lastly, we would put everything on a roadmap. As I said before, we phased the initiatives out over 3 phases. In total, over 40 initiatives were recommended. The client has proceeded to implement and deploy initiatives in the first phase and are now in the second phase of building out those initiatives. So this was a very successful project with a real client, where we showed that trust is not just a theoretical concept, but can actually be operationalized by looking at the 6 different components that Mark described earlier in our trust framework. I just want to talk a little bit about what you can do right now to get started. I think it's important to align leadership with the trust notion or trustability. So we would recommend conducting an internal working session to discuss trustability with your leadership team, conducting a trust survey to assess the trust baseline that exists, and benchmark it against our research, and would be happy to help you with that if you are interested. As we mentioned before, the employee surveys were quite illuminating, and the level of enthusiasm and participation was quite high from the employee survey. So we'd encourage you to conduct employee surveys in order to gain additional trust insights as well. Developing trust guiding principles, I think, is a useful exercise for the management team to gather around, how the company, how the organization should face its members and customers in a united way. And then the last one is a bit more tactical in the sense that it gives you a specific recommendation on what you can do with your communication. We've observed that in a lot of the ways that healthcare payers operate, member communication could be simplified. A lot of the members do not understand the language that is being used. And so we do think that even within the confines of the rules and regulations that exist in your industry, a fresh view of how you communicate with your members is a very good exercise. So I want to turn it back to Liz. I think we do have another poll question coming up before we open it up for Q&A. Liz?
Yes, thank you, Dietrich. We do have one more poll question. Before we get to your questions, we've got one for you guys. And the question is, obviously everyone here on the call thinks trust is an important imperative to business success. But we're curious, within the scope of your entire organization, where does trust sit within your organization's priority list? So is it number 1 on the list? Is it fairly high? Is it somewhere in the middle, somewhat lower, very low, or not even on the radar? So we're just curious to see where trust really fits in an organization's priority list. So if everyone wants to take a moment and answer that question, then we'll take a look at the results and then go into the Q&A. So while you're answering this question, also feel free to submit any questions you've got based on the presentation of Mark and Dietrich. I know we covered a lot of really interesting, in-depth information, so we've got a few questions lined up already, but feel free to send some questions along as well right now. So let's get the answers to your questions, which is, for most people, trust sits fairly high in the organization's priority list, 50% of you, which is great, knowing that all of us as consumers want to have more trusted relationships with the companies we work with, so that's great. So let's quickly move on to just one quick slide. I want to talk about the fact that we're only beginning the conversation when it comes to trust and customer strategy. The PRG Healthcare team has a lot of activities happening in the near future we wanted to just share with you. For those of you interested in learning more about customer strategy in healthcare, we invite you to, as Dietrich mentioned, use our methodology to conduct your own trust research with some assessments and benchmark them against the data that Mark had presented earlier. We can also facilitate some working sessions and on-site workshops around your company's unique needs. So feel free to contact us if you're interested in working in that way. Also, we've got 2 future webinars relating to trust. The next one, April 25th, is Social Media Agenda for Healthcare. And then we've got a detailed case study discussion on May 17th about a health insurer who transformed their entire business to be more customer-centric. So keep those in mind. And also we'll be at the World Healthcare Congress April 16th to 18th in Washington. And Mark will be moderating a panel called Competing in the New Consumer Market. So feel free to stop by our booth or to the session and say hello. And then, as always, we are on Twitter discussing customer strategy issues in detail all the time. Okay, great. So now let's get to some of your questions. I know there's quite a list. So I guess this first one, Dietrich, perhaps we can start with you. How did you measure the impact of the trust initiatives that you presented, or how would you recommend companies measure the impact of trust?
Well, thanks, Liz, for that question. I think, Mark, in the early section and also through our research, we linked trust back to some financial metrics such as loyalty, retention, word of mouth, and so on and so forth. So when you look at the different trust initiatives that we developed for our clients, some of them were targeting different aspects that would impact different financial outcomes. So what we did was we tried to link the particular trust initiative back to a particular metric, financial metric, whether it's related to loyalty, being able to extend the tenure of a member or customer, and then build a business case around that. So that's how we measure the impact of the trust initiative.
Great. And another question, Mark, maybe you can start answer with this one, but feel free, both of you, to answer. It seems that becoming trustable and building up those building blocks, it will require significant investment. So how do I overcome some budget limitations to move down that path?
Sure. Thanks, Liz. That's a great question. I don't know if one person submitted that or a number of people did, but that's one that our clients ask, sort of fairly on in this discussion. And I think there's two primary answers. The first is that it doesn't have to be a huge investment to become or to begin to become a more trustable company. And I'll come back to talking about that for just a minute. I think the second part, or the second answer, though, is justifying or creating a rationale and business case for making changes, making some investment in the trust platform that we talked about. It can be approached in a very similar way to business cases for other things that you do in your business. And so when in doubt about how to do it as it relates to trust, I would fall back on how would you do it, if you were buying a new tool or building a new customer service center, or getting funding for a new campaign or something like that. But the first part of the answer is that it doesn't have to be expensive to begin. The client that Dietrich referenced did not have a tremendous budget to get started, and so our work with them initially focused on understanding where their organization stood with their current customer base, as it related to all of the facets of trust that we talked about. And the goal of that first piece of work was simply to understand how big of an opportunity is this. And as a result of that piece, this particular organization decided that becoming more trustable was going to become one of 4 strategic priorities for the organization. And so armed with the real world company and customer specific information about where they stood at present day, that enabled the organization to make that decision to put building trust or building trustability toward the very top of their priority list. And so a relatively small, initial investment. In some cases, it could just be, the time and access to some of the current capabilities that your organization has. And in other cases, it might be, a small external investment. But those initial investments really paid off in the insight that they delivered, in the compelling nature of the dialogue within the client organization, and then finally, they really served as a good guide for how, when, and how quickly to invest in becoming more trustable over the next couple of years.
Great. Well, it looks like we're just about out of time, but I did want to thank both Mark and Dietrich, for this wonderful presentation. A lot of great insight. I really hope that all of you attendees can take something away from this to help improve trust within your own organizations. Thank you, everyone, for joining us. If anyone had any questions that were not answered, we will send them via email, so don't worry. And this concludes the Navigating the Roadmap to Trustability webinar from Peppers & Rogers Group. And on behalf of the entire team, I want to thank you all for attending and wish you all a great day. Thank you.